All right. Just finished my office day. So hopefully you're able to see and hear me. We're going to go ahead and get started. I see other people are still joining. So if you're able to see my presentation screen, please go ahead and raise your hand. And all right, that means we're off to the races. Thank you, everybody, for joining me. This is the Full Circle Women's Care Practice and Pregnancy Orientation webinar. I am your host, Dr. Adams. Some of you had your history visits with me earlier today, so thank you for not forgetting me. Some of you saw me for your confirmation recently, and some of you will be having your history visit with me coming up very soon. All right, so we're going to go ahead and get started with some housekeeping items. One, everything that happens here is confidential. So please feel free to ask me questions in real time. You can ask questions and I will answer them as we get to certain subjects. Some of them I may say, hey, hold on, I'm going to address that in a moment, but no one will be able to see who you are asking questions. So feel free to ask anything. There are no silly questions. I have poll questions hidden throughout here, so please feel free to participate because the more you ask me questions, you never know if somebody else had the same one. If you have to hop off at any point, no worries. I understand we might run into dinner time. This presentation will be available for you to review on our YouTube channel for the duration of your pregnancy. So we're going to start with a poll question to just kind of give you an idea of how they go. So this is our first poll question. Who's on the call? How many first-time moms do we have here and how many mommy veterans? So I will read over the question, give you a couple of seconds to answer, and then I'll say the polls are closing in 5, 4, 3, 2, 1. And then I will share the results. So this time we have a lot more first-time moms on the call than mommy veterans. I notice probably only half of the people on the call answered, so some of you may be listening like a podcast, and that's fine too. But we will hopefully still be able to get questions from you when you get someplace stable. So today we're going to go over the full circle experience, which includes where we deliver. We're going to talk about our office protocols, go over what to expect at each of your pregnancy visits, go through a lot of prenatal resources, talk about exercise and nutrition in pregnancy in depth, and then finally end with an upper respiratory illness update, not just COVID-19. So first, our practice philosophy. We are a collaborative midwifery model, which is based in the principle that pregnancy and birth are normal life processes, not some disease that we have to cure you from. In the traditional midwifery model, it was designed to care for normal women with no complications with their pregnancy, low risk, and if they identified certain abnormalities, you'd have to transfer out of being able to deliver with a midwife to access physician care. In the collaborative model, it still allows you to stay in the care of the midwife for labor and for prenatal care, but with physician direction for any complications. So to that end, most of the labors and deliveries are attended by our certified nurse midwives, which includes VBACs. And if there's something outside of their scope, then they consult the physicians to come in and help manage with that. So if it's something urgent, like can't wait until morning, can't be scheduled, then they call us, the Full Circle physicians, Dr. Mayer, Dr. Mooney, myself. We are on call, always backing up our midwives. If it's something emergent, like can't wait 15 minutes for one of us to get in from our home to take care of you, then they call the OB hospitalists. So we have board certified OBGYNs who are physically in-house 24 hours a day for true emergencies. And to put that in perspective, last year we did about 600 deliveries. 4 of them required the hospitalist to be there. And the most common emergency is that someone comes in 10 centimeters and we're just not actually physically there yet. And we have the baby before we get there. So please call us if you're going to the hospital. Which hospital? Good question. We deliver at HCA Florida, which is formerly known as Memorial Hospital. It's less than 10 minutes from our office over on University Boulevard. And you have a chance to tour their facilities, multiple different opportunities. One, they host a quarterly baby shower for you to come and see the facility. The last one was in May. I think the next one is going to be in August, but the dates are listed in your exam rooms. If you're not able to make it on any of those dates, and those are really cute, they have doulas come out and do vendor tables. They raffle off prizes. It's really sweet. But if you're not able to make those between stork tours, you can register for a class by going to their website. Register for a class is actually selecting a labor and delivery tour. Then you just pick a date twice a month. Brittany, the childbirth educator there, does tours of the unit. Our office is open Monday through Thursday from 9 to 1. We then close for lunch from 1 to 2, and then we reopen at 2, and we're open until 5. So if you call us between 1 and 2, you will get the after hours line. That's not a mistake. The phone's not broken. If you're calling between 1 and 2, the reason we have it rolled to the after hours line is because that's directly attached to a phone that one of the providers is carrying. So if you have a medical emergency during that time, you can still reach them. They do not take administrative messages during that time and relay them back to the front desk. So please don't leave that on the phone between 1 and 2. It's strictly for medical emergencies. If it's something, I think I'm going to be late for my 2:20 appointment, just call back after 2 and you can talk to front desk. Press 0 to get a person. On Fridays, we are open from 9 to 1. So if you are calling with something administrative at 12:53 on a Friday, that may be delayed until we reopen at 9 a.m. on Monday or Tuesday if it's a holiday. For appointments, we do not do walk-in appointments. Our goal is to see you at as close to your appointment time as possible. And in order to do that, if we promised you the 10:20 spot and somebody walks in at 10:15 saying they need to be seen, that is not fair to you. Your appointment time is your appointment time. There are limited same-day appointments. So if you're calling at 9 a.m. with an issue saying, I really need to be seen, it's not super urgent, but I think I need to be seen. People deliver, forget they have appointments, cancel things. So there are some appointments that are open on the same day, and front desk will put you into one of those spots. If it's an urgent matter, like you're calling at 10 in the morning and our next open appointment isn't until 3 p.m., then we might recommend that you either go to urgent care or labor and delivery, because we're not saying we don't want to see you in the office. We're saying we agree this is an urgent matter and it shouldn't be sitting for 5 hours waiting to get worked into our schedule. When you do call, the providers are not able to leave a patient appointment to take phone calls because, again, I promise you the 2:40 spot, then it's not fair for me to get up in the middle of your appointment and go talk to somebody else when you've come in. And so we ask that you have the same respect for your fellow patients. When you do call to leave a message, you do need to leave one to receive a call back. We don't just check caller ID and call everybody back, because a lot of people pocket dial their gynecologists. So in order to contact different people here, Sierra is taking our nurse calls. So there are certain things that happen over and over in pregnancy, and she's able to answer them off the top of her head. If there's something that requires her reaching one of us, then she'll let you know she's reaching out to the provider on call or catching one of us between visits to get an answer for you. So give her a chance to talk to one of us and get back to you. She also handles letters, forms, FMLA paperwork, connection to the app that we use for that, and those parking passes. OB clinical coordinator is Naisha. She's the one who emailed you your prenatal labs after your history visit. She also handles referrals. So if you need to see a cardiologist, hematologist, or the high-risk OB doctors, or if at the end of pregnancy you need an induction, C-section, or what have you scheduled, Naisha is the one who does that. And then many of you already met with Renee Hall, our benefits coordinator, when you came in for your confirmation. She's the one to talk to if something changes with your insurance. Many of you will be pregnant over December into January. And so Renee is the one who, if anything changes with your insurance, please, please, please notify her so that we can, adjust and update on what your new insurance dictates for personal financial responsibility. After hours, there is always someone from our office on call for our practice. This is the emergency on-call provider. So this is also the person who is physically in the hospital doing deliveries, managing labors. So she's not someone who you're calling saying, hey, can I get a refill on my prenatal vitamins? You call her if you think you need to join her in the hospital. And you also do have to leave a voicemail to receive a call back for what you're looking for after hours. The patient portal is a way to contact us, but remember that the response times can take up to 2 business days. So if you send a message on a Thursday, the next business day is Friday, and the next business day is Monday. So don't send things in the patient portal that cannot wait 2 business days. If it is a non-action item, things along the line of, oh, just wondering if I could take this vitamin or drink this tea, that's something we might defer to your next appointment because we will be seeing you a lot. The portal is best used for things like, oh, I lost my lab slip. So if you lose your lab slip and you need us to email you another copy of it because you want to get the blood work done before you come back for your next visit, use the portal for that, and we're happy to send you an email. If you have a cold, upper respiratory symptoms, and you want to convert your visit to virtual, as long as you have 2 business days before your appointment, the portal is also a reasonable place to communicate with front desk about that. Please do not send urgent matters on the portal. So people still are sending me, my blood pressure's been really high for several days. Is that okay? And then 1 or 2 business days later is not when that should be addressed. If you don't feel your baby move, if you're having heavy bleeding, those are things you need to call the emergency on-call provider about. Please do not send blitz messages, meaning sending the same message, copying and pasting it to 5 different providers to see who's going to answer you first. It is abuse of the portal, and also multiple messages to one provider and or different providers. We've seen the system actually think that you are a bot trying to spam the system, and it will delete your portal account altogether. It's really hard to get that reinstated. So we ask that you just send one message, give that person 2 business days, and then if they don't answer, close that message and start another one. If you've been having a discussion with one provider about something, please continue to answer in that same chain rather than starting a whole new message that says, and now what? Because I sit down to my computer and after answering 75 other messages from yesterday, I don't know what and now what it is about. So if you keep it in the same thread, then we can keep the conversation going easily. We ask that you don't try to have an appointment over the portal. If you're sending in labs, asking for our opinion and read this study and tell me if you think it applies to me, that's an appointment. Remember, the portal is something that we do after we've seen patients all day, done all our charting, reviewed all our labs and ultrasounds. This is our family time. So if there's something quick that we can do before we spend time with our families, we're okay with doing that, but we really don't want to do 25 additional mini visits after we get home. Text yourself questions, start a text thread, and or schedule an appointment. Come on in and we can go over those labs and studies and talk about how they relate to you. Ultrasounds are also released on the portal. And they are, if there's something urgently abnormal about it though, we won't let you leave the building. We will interrupt our schedule. This is the one exception. We'll interrupt our schedule and make sure that someone comes and talks to you and makes a plan for what was noted on the ultrasound. Otherwise, we don't have the report when you leave the building. The ultrasound tech has to create her report. We have to download it from the machine, upload it into our electronic medical record system, divide it among the providers, and then send it out to you for review. So give us 2 business days to make all of that happen. Give us a chance to receive it, review it, and then release it to the portal. Sometimes you'll see the sonographer typing away at the end and you'll walk out to your car and say, what's on my ultrasound report? The answer is going to be, I don't know yet because I don't have your report. However, if you know your anxiety is not going to let you wait like 2 business days, make an appointment to see a provider on the same day as your ultrasound. Because that way the sonographer can print out a preliminary copy to give to your midwife, and she can go over it with you at your visit on that day, and then you'll get the report within a couple of business days. Quest also has a portal, but they will sometimes send the results to you and not to us first. So you'll get the results. You see red here and there, and it freaks you out. Just a reminder that red does not necessarily mean abnormal because you're pregnant. The reference ranges that they use to say what's normal are not the same for pregnancy. So give us a chance to receive the labs from Quest. We ask you not to upload your own labs to the portal and say, hey, look at this. What does this red mean? Give us a chance to receive them from Quest so it will close our loop and let us know that Quest did receive our order and they filled it. and then we'll review it and we'll release it to the portal. If you've had your own results on your Quest portal for more than a week and you haven't gotten them from us, then definitely let us know, because sometimes we don't get them from Quest at all. Those are few and far between. But the most common reason that we don't get them is inconsistency with the name that you gave at that facility. So we ask you to use the same name every place you go. Some of y'all are like CIA agents. You've got secret names for every place you go. If you are engaged and during the pregnancy you get married and you were a Johnson at the beginning, you're a Johnson at the insurance company, but you're a Smith in your heart, we need you to stay a Johnson until you become a Smith with your insurance company and the courthouse. So please have you use the name that matches all your insurance information and where you go every place, because our electronic medical record system scans for demographics and it won't recognize that you have a different name, and it won't sort into your chart. So it will look like your labs never came back. Any questions on contacting us? All right, cool. What to expect at your prenatal visits. First, expect that you will forget all the questions that you had when you were at home. So start a text thread with yourself to text yourself questions as they come up so that you can bring them and ask them at your appointment. We want you to wear loose, comfortable clothing so that we can get to your belly. We will not do an ultrasound at every visit, but we will do a Doppler where we listen to the baby's heartbeat at every visit. We want you to get here about 5 minutes before the scheduled appointment time, so you'll have time to check in at the front desk, let the MA bring you back, and take blood pressures. You do not need to leave a urine sample routinely. The American College of Obstetricians says that that's no longer required. We only need a urine sample, and this is something that we would discuss with you individually. If you've had high blood pressures and we're looking for urine protein, or high blood sugars and we're looking for glucose in your urine, or if you've had a recent urinary tract infection and we need to get a test of cure. Otherwise, we know you are pregnant, you've been driving around drinking your water all day, and you need to go to the restroom. So when you come in, feel free to go ahead and do that, but that's why we want you to get here early so that you're not going to the restroom while your provider's standing outside waiting for you. If you are 10 minutes late, we will still have time to check on you and the baby, but it leaves less time for our text thread of questions. If you are 20 minutes late, you have missed the entire appointment, and we may be able to work you in later in the day in some of those open spots that exist. But if those times don't work for you, then we'll just reschedule to a date that is mutually good for both of us. When am I getting another ultrasound? Great question. So diagnostic ultrasound visits are separate from your prenatal appointments. So the way to know whether you have an ultrasound schedule is when you look in your portal, do you have more than one appointment time? And is there a provider's name associated with your visit? So Tina Test is my imaginary patient who goes to her portal and she clicks on appointments. And when she does, she sees that she has 2 appointments scheduled in one day. The first one is at 9:20 with ultrasound, which is not a provider's name. And the second one is at 10 o'clock with Dr. Yeckel, which is a provider's name. So Tina knows she can bring her family to the appointment at 9:20 to see the baby. And then at 10 o'clock, they can either take off, or Dr. Yeckel will have a copy of her report to go over the preliminary results, and she'll get the final report in a couple of days. So remember that the results, the report, are sent to the portal within 2 business days unless there is something urgently abnormal, in which case we discuss those findings the same day. We won't let you leave the building without a plan for what the next step is if there is something urgently abnormal about your ultrasound. Most things that we see on ultrasound, we say we're going to follow them up in about 4 weeks. But an urgent abnormal thing is something that typically needs a referral to the high-risk doctor. So when you're checking out of your regular prenatal visits and your provider has said to you, hey, let the front desk know that you need an ultrasound next, be sure they are scheduling 2 appointments, your regular prenatal appointment and your diagnostic ultrasound visit. Now, if we don't need to see your baby medically, but you need to see your baby socially, then you can do boutique ultrasounds. These are cute little fun ultrasounds done at different facilities throughout the city. I've listed a couple here for informational purposes, not endorsing any one over another. I know there is one in St. Augustine too. But these places do those 3D ultrasounds. They do sneak peek for baby's gender at 14-ish weeks. And just cute little, they put the baby's heartbeat in a stuffed animal, just all sorts of things that are very, very sweet. So feel free to have these. They are absolutely safe. Ultrasounds do not have radiation, and so they are a fun way to look at your baby as much as you want to look at your baby. All right, next poll question is something that I did answer already. When would you expect routine ultrasounds? Are you going to have them every single time you come in? Or are we only going to do ultrasounds if we think something is wrong? Or at 20, 40, and 41 weeks? And the polls are closing in 5, 4, 3, 2, 1, done. All right, you will have your routine ultrasounds, meaning everything is going well in your pregnancy when you're 20 weeks, when you're 40 weeks, which is your due date, and then if you go past 41 weeks as well. We are not, nobody this time said at every visit. Good job, guys. All right, but if we see everything we need to see on the 20-week ultrasound and you don't have any other medical issues with the pregnancy, you would not need another one medically from us until you hit your due date. All right, so we are going to head over to our website. So give me just a second and you'll be able to tell me whether you're able to see the Full Circle Women's Care website. So, all right. You should be seeing fullcirclejacks.com now. Raise your hands if you're seeing it. Okay, fantastic. All right, so this is fullcirclejacks.com, and everything that we're going to go over for the next couple of minutes, you'll be able to access by taking a look at our website. All right, so we're going to start with the providers, and currently, we have the physicians here, myself, Dr. Merrill, Dr. Mooney, Dr. Yeckel. We have midwives galore. We have a PA. So many people work here. And so you'll get a chance to meet them because we do rotate call. So we're not sure who's going to be on call when you deliver. And unless you have a really strong desire to deliver with a certain person, so much so that you choose to be induced on their day, any one of us could be the person who gets to be the lucky one to help you usher your new little one or ones into the world. So over here, we're going to see patient information and you'll see the obstetrics tab. That's where you'll know you're in the right place when you see the growing bellies and then the baby there at the end. So here we have our delivery statistics back to 2018. So here you'll see your chances of delivering via cesarean, your chances of a successful VBAC. A lot of good things here. So when you get a chance, go ahead and peruse those stats. We're very transparent with our numbers. The first thing we're going to take a look at, though, is our prenatal care timeline. So this is where you find what to expect at each visit. So everyone on this call has already done their pregnancy confirmation, which is the initial ultrasound where we set your due date. You also met with Renee Hall and reviewed your benefits. And then after that, about 2 weeks afterward, you have a virtual visit with me, not here on Zoom, but through our website. You have a virtual visit with me where we go over your medical history and, if applicable, your pregnancy history. At that visit, we determine which blood work needs to be ordered for you. So there's standard pregnancy blood work that we order for everybody. And then based on the medical history you give me, there may be some additional things that we want to order. If you decide to do genetic testing, that will be your first opportunity to find out whether you're having a boy or girl. You have to be a minimum of 10 weeks to do that, and we will get that ordered for you after you see me for your history visit. At this point in the pregnancy, we're seeing you every 4 weeks. So roughly 4 weeks after your pregnancy confirmation, we're going to have you back in the office for your OB physical. And the OB physical is just like it sounds, just a routine physical exam. Heart, lungs, breast exam, pelvic exam includes cultures. We do not need a pap test. You see this on here, that is optional. So the pap isn't really part of the American College of Obstetricians panel, but if you are due for a pap, some people say, I don't want to do this again for another 3 years anyway, and you're going to be down there getting cultures, go ahead and do it. But that is completely up to you, and you can talk to your provider about that when you come in for that visit. If you needed a high risk visit, typically that's something you and I would have discussed when I saw you for a history visit. And then the high risk group to whom we refer, regional obstetric consultants, usually sees you right around 12 to 14 weeks for your first visit. Then we're moving into second trimester. And second trimester, that first trimester ickiness, the nausea and fatigue gets a lot better. and we keep seeing you every 4 weeks. So you're coming back in for a belly check. We talk about second trimester changes. And then 20 weeks is that first ultrasound that we talk about. So this is the anatomy ultrasound where we look at the brain, the kidneys, all the body structures. And if baby is cooperative, that would be your other chance to find out whether it's a boy or girl. If you're meeting with a midwife that day or soon after, this is when she's going to start discussing childbirth education classes or breastfeeding classes. You'll also see here in the middle a mental health screen. So we do these about halfway through pregnancy. And it's just kind of a check-in because not everyone with postpartum depression, anxiety, or rage is a surprise. Sometimes these are antepartum problems that could have been identified and we could get ahead of them and identify people who are at risk to take care of the whole person by doing a screen early on. About 4 weeks after your anatomy ultrasound is when we start talking about the glucose test. And I know I'll have some questions about that, so just put a pin in it because we are going to come back to that and talk about it in depth. For my moms who have a certain blood type, we want to make sure we secure your ROGAM injection to give you between 28 and 30 weeks. So at this point, we are completing your hospital registration. If you delivered with us before at Ascension, it was paperwork you filled out and just mailed in. Now everything is online, and there's a code that you scan at the front desk to be able to access creating your account at the hospital. You want to check out your hospital tour during this time, and if you have not already selected a doula, which the doulas have told me, please move this to first trimester, you definitely want to make sure you know who it's going to be by your third trimester. And we'll talk about doulas in a little bit as well. Now we're moving into third trimester, and you'll see here the option to repeat or decline your standard prenatal labs. This is kind of based on Duval County, the health department recommendations versus American College of Obstetricians. For certain high-risk populations, they recommend screening closer to delivery to make sure nothing is missed. If you feel you're not in that high-risk population, then you can definitely opt out of repeating them if that is your choice. Third trimester, early third trimester is also when we talk about boosters for vaccinations. If you plan to get them, we don't do them here at the office, but if you would like them, then we send a prescription to like Minute Clinic or whatever pharmacy you go to and have done. First-time moms, you want to decide who your pediatrician is because once that baby is out, he or she or they need their own doctor. I'll still be your doctor, but your baby needs their own doctor. Veteran moms, you want to make sure if you're staying with the same pediatrician's office, let them know you're expecting another baby. And then we're going to start seeing you every 2 weeks. So moms who are in a certain category of taking medications for other health issues will start doing some additional testing right around this week. And then we keep seeing you every 2 weeks until 36 weeks. For my moms who know that they are going to be having a belly birth, which is our term for the C-section, you'll be seeing Vanessa, our PA, mostly because she does scrub into some of our C-sections. So she'll help you get that scheduled with Naisha and get her schedule adjusted for that as well. So we start looking at that date at 33 weeks. Usually we have it for you by 35. 36 weeks is when we do another pelvic exam for group beta strep, and we'll explain what that is and why it's important at that time. And if you've opted out of repeating your STI screening up here, you can opt out of repeating it again too, down here. So 36 weeks is when we start seeing you every week. And at that point, we want you to bring in your birth preferences so we can, just kind of set expectations for what happens in the hospital. We'll talk about natural cervical ripening methods in a moment. For most of our belly birth moms, they are delivered between 37 and 39 weeks. So they're usually off the train by 39. And then for those who are waiting for labor, we do some testing when you go past your due date, and we wait and wait and wait. And we like for all babies to be out by 42 weeks. So we give you these dates. For first-time moms, 41 weeks and 5 days is when we start talking about looking at induction. For second-time moms, 41 weeks and 6 days. Average length of labor for first-time mom is 24 hours. So for us to induce, it may take a little bit longer to get you into labor, so we give ourselves a couple of days to let that happen. For second-time moms, your labor is usually about half the length of first-time moms, so we don't have to bring you in quite as early. All right, next poll question. If you had a headache and you needed to take something, are you more likely to take a Tylenol, to meditate, or to go to the emergency room? And I don't, yeah, here we go. All right, polls are closing in 5, 4, 3, 2, 1, done. All right, so this week we have more meditators than medicators. I'm a medicator for myself personally, but whatever you guys decide works for you. I think it's funny that a lot of times it's the veteran moms who say that they're going to take a Tylenol. All right. In any case, this is our list. It's non-exhaustive, but it's our list of safe medications in pregnancy. So on the left, you'll see an alphabetical list of common symptoms in pregnancy. In the middle, you'll see the relief measures that we would recommend first. And then on the right side, you'll see things that you can purchase to help with it. And not everything on the right side is a prescription medication or a Western medication. You'll see, things like vitamin B complex and diffusing peppermint oil. But some things that, you'll just see what the warnings are, like not taking Pepto-Bismol, and not using alfalfa if you have an autoimmune disorder. And then this warning for nausea, vomiting, because most people on here are first trimester or early second. If you cannot keep down fluids for 24 hours, please don't keep trying C-bands and ginger. Please go ahead and give us a call because you probably need some IV fluids or some medication. So just remember that this is out here and you can access this at any time. Next, you'll see the gestational diabetes screen. I won't go in depth right now. I promise it is still coming up. But this is information on how to prepare for the test, including the different patient-driven options that are available. So just remember that this is out here. This is information that you won't need until you're about 24 to 28 weeks. Weight gain in pregnancy. For those who are concerned that they've been sick in first trimester and haven't gained enough weight, these are the recommended weight gain amounts for your entire pregnancy. And you can find out what your amount is by clicking on this link here that takes you to put in your height and weight and calculate your pre-pregnancy body mass index. That's what it's based on. So based on that, if you're having twins, you can add 10 pounds to each of these upper numbers. And then but what I really want you to see is that the rates of weight gain are in your second and third trimester per week. So just kind of, this is a nice guide to sort of keep you on track for making sure that you don't put yourself at additional risk for other complications of pregnancy by gaining too much weight. Birth preferences. So this is our template for a birth plan. So especially for first-time moms, there may be some anxiety about the fact that you've never done this before. And so you're like, I don't know what to plan. I don't know. I've never even been at a birth before. So this just introduces some scenarios where you can make some decisions that help you to exercise some control over what your experience looks like without, making dangerous choices. Like, I don't want to be monitored, like you want your baby to be monitored because that's why you're here, so that we can be there in case your baby doesn't look like they're doing well. But these are things like, how do you want labor to start? What do you want to wear during labor? How do you want to be monitored? Because we do have wireless monitors, so you can move around, walk around. We don't strap you to the bed or starve you. The different options for pain relief are on here. I will say the exception is nitrous. It's in the building, but there's not a policy for it yet, so we're not able to give it out yet. But that could change at any moment based on the bureaucracy and red tape that we're having at any particular hospital. Hydration, how you want to nourish yourself during labor, what positions you want to labor, push, or deliver in. Those are all on here as well. Our standard is usually perineal massage, slow delivery of the head. I can count on probably now 2 hands the number of episiotomies I've done in the last 20 years. Cutting the cord, we usually do delayed cord clamping. We're also going to add in here with regard to placenta. There is now, people have been asking for years, is there a way to donate my placenta for stem cells for regenerative medicine? And there is now. There was only the public cord blood bank in Orlando before, but there's now placental donation available here. So we're very excited about that being available at the hospital. Immediate skin to skin. The newborn medications are are listed here. You always have a chance to come in and discuss with your midwives what the rationale is for each of these medicines and see whether or not they apply to you. If you're planning to have a son and decide whether you want to have him circumcised, twin moms have choices too. And then our belly birth moms, we practice gentle cesareans, which are family-centered cesareans. And so that's something that Vanessa kind of goes over in greater detail with you when you're having your visits with her. So these are things you're going to bring in closer to the end of pregnancy. Cervical ripening techniques, again, toward the end of pregnancy, just kind of highlighting right now that this is out there. You don't have to go scouring the internet to look for a magical drink to make your baby get out. These are things that you can do to start ripening the cervix. These don't put you into labor, but when baby gives the signal for labor, these are things that help your body to be prepared for labor. And these are based on recommendations from evidence-based birth. So just remember that that's out there. I do have a question about how many moms I have on here who have had a prior cesarean and are planning to do a VBAC. Anybody out there? I know first time moms, it's not you, but as you can see, there are only two choices. Either it's not you or yes, and you're going to rock it. All right, awesome. We are, so I do have a couple of VBAC moms out there. So first time moms, this is for you too. Because basically both of you all are doing the same thing. You're trying to avoid a C-section, where a C-section is quite possible. It's less possible once you've had one vaginal delivery. So ways to reduce conversion to cesarean: control the things you're able to control. Babies are going to baby. We can't control how the baby's going to react to you having, to you laboring. But what we can control some things about ourselves, whether our bodies are in good shape to deliver, whether the baby's in good position to deliver. So Webster certified chiropractor care, pregnancy yoga, doing your method courses so that you learn your breathing and your positional techniques, doing your daily squats, only gaining the recommended amount of weight during pregnancy, getting an experienced doula. Don't cheap out on the doula. Doing your spinning babies and mile circuit, and avoiding getting tired of being pregnant. First time moms, y'all are always say, I'm over it. I just want to meet the baby. A non-medical induction prior to 41 weeks might increase your risk based on your baby's position. So just trust your body to say when the baby's supposed to come out, and trust us, because we don't want you messing up our stats either, and we want your baby to come out nice and healthy. And then finally, if you do have your son circumcised, these are our instructions on how to care for it afterward. So this, we go over this when you come in as well, but just know this is listed on the website, including whether you plan to give him Tylenol afterward. Okay, so we are headed back to the presentation now. So let me know when you are able to see my presentation again. You can raise your hand for that. All right, very good. Okay, so for those who are concerned about, hold on, let me move this off the screen. Those who are concerned about weight gain, but they're saying, oh my gosh, Dr. Adams, I'm only drinking coffee. It's not that bad. I really don't know. Are you really drinking coffee, or are you drinking this caramel mocha monstrosity here? Did you know that pregnancy only requires an additional 300 calories per day? It takes 10 calories to maintain 1 pound of body weight, and your pregnancy goal, as we saw, was based on what your starting body mass index was. So if you start your pregnancy at 170, it takes a net 1,700 calories to maintain that. If your goal is to gain 25 pounds during pregnancy, that adds an additional 250 calories. So that gives you a total of 1,950 for the day, divided between breakfast, lunch, and dinner, and you can have 650 calories. Now, keep in mind, if you are drinking a 570 calorie drink, then you can't wash down your 650 calorie meal with that. Don't drink your calories. Your baby doesn't know the difference. They will take what they need and leave the rest for you. Happy Mother's Day. This is a busy slide with some nutrition facts, just kind of showing you where those calories should be coming from. because this food is not a good choice. It's got almost half of its calories are coming from fat. You want to make sure that you're getting enough protein and fiber in your meals as well. So just looking at how things are divided, typically 5% or less is low, 20% or more is high. And this is just about sodium, because in that third trimester, when your rings don't fit anymore and you send me a message, Dr. Adams, I'm swollen. And I ask you, what did you have to eat last night? And you say Chinese food with extra soy sauce. So changing little things like going from traditional spaghetti sauce to herb infused marinara can drop 500 milligrams of sodium for one serving. That is major. So you want to eat your fruits, veggies, whole grains, cereal. You won't give your baby nut or dairy allergies if you eat those things. So carry on if you enjoy them. For my coffee drinkers, you want to make sure you're keeping it at less than 200 milligrams per day, which is still a lot of caffeine. Especially in third trimester, though, you want to watch out because the caffeine can cause irregular heartbeats in the baby. It doesn't happen very often, but a lot of times when it does, moms cut out caffeine and it goes away. Herbal teas are fine in pregnancy, including raspberry leaf, ginger, lemon, and peppermint. Those are our favorite for pregnancy. For my pescatarians and vegetarians, please be sure that you are getting at least 70 grams of protein per day. Actually, 70 is your sweet spot. I know there are some diets that tell you you need 120 grams of protein per day. Please don't do that. You will grow an 11-pound baby and just make things more difficult for all parties involved. 70 grams is a very nice place to be to grow a normal sized human and still get all the protein that you need to build your muscles. You can have deli meat as long as you microwave it for 30 seconds. It does not have to be piping hot when you eat it, but just be sure that you have microwaved it sufficiently to kill any bacteria. Soft cheeses, as long as they are made with pasteurized milk, are fine. So if you're at a restaurant and you can't verify how the brie was made, then maybe we skip the soft cheese for the night. If you're at Trader Joe's and you can flip it over and see pasteurized milk, go for it. Canned tuna, you can have up to 3 4-ounce cans per week. And if you are a pescatarian and you need to know more about the different fish that you're able to eat or seafood you're able to eat, the FDA does have a very nice document. This is the latest iteration of it. It was last updated in October 21. But fish that you should eat a lot of because they're high in DHA and omega-3s, which are good for baby's brain development. Fish you should eat in moderation because they're neither plus nor minus. And then fish you should avoid because of methylmercury content or things of that nature. You want to avoid undercooked fish at all costs. You want to avoid undercooked meats too. So if you're a foodie like me and you love your roast duck that's medium or whatever, you will have to ruin all of your food for the next several months and make it all well done. I'm sorry. Kombucha drinkers, kimchi eaters, sauerkraut. These are fermented foods. So just keep in mind that that your body may treat this depending on how they're prepared, whether it's like an alcohol. And to that end, you also want to avoid alcohol. So the kombucha, kimchi, sauerkraut, heat them, moderation, you're fine. Alcohol is a no because we don't know what the safe amount of alcohol is. For sodium, you want to keep it under 1,500 milligrams per day. And just remember that slide about cutting 500 milligrams very easily because over 1,500 milligrams, you will definitely start retaining water in your third trimester. So do I have questions about food? Okay, either I'm answering all y'all's questions or y'all are asleep. All right, we're going to talk about exercise and pregnancy next. Maybe this is where you all come alive. You can continue whatever your pre-pregnancy activity was as long as your pre-pregnancy activity was not doing nothing. You just won't feel like it in first trimester, and that's okay. You'll get easily winded in first trimester. That is normal. Second trimester, you increase your blood volume by 50%. So increase red blood cells, oxygen saturations, those help you to do more of that aerobic activity. So just listen to your body. You get a pass for first trimester, but second trimester, when that pass is revoked, we want you to start doing some activity. So it is okay to start a new regimen if you weren't doing anything prior to pregnancy, because please remember, a sedentary lifestyle leads to a malpositioned baby. And the most common reason that we do C-sections is not because baby's too big or baby's in distress. It is because baby is head down, but face is up. So we don't want baby's spine to face your spine. We want baby's spine to face your abdomen. And that is the easier way to deliver a baby. Those of you with these Fitbit watches, Apple watches, tracking your heart rate, it is normal for your heart rate to go up by 10 to 20 beats per minute at rest. If you are not getting dizzy or lightheaded about the higher heart rate, it's a physiologic change. It is normal. There's nothing that has to be done about that. It's normal. For those of you who are walking for your exercise or chasing other little ones at home, exercise is considered exercise if your heart rate is in the aerobic zone, just 70% of your maximum heart rate. And so you get the max heart rate by subtracting your age from 220. So if you're 30 years old, you should not be exercising with your heart rate consistently above 190 for an extended period of time. 70% of 190 is 133. And so that's where your aerobic zone starts. So when you are exercising, your heart rate should be between 133 and 190 for 30 minutes, 3 times a week. That's your exercise goal. And that's real exercise. If when you're walking or chasing the kids, your heart rate is still like 90, maybe 100, that's probably not exercise. It's probably just like transportation, which is fine, but it's not, I can't count it. So what's safe to do in pregnancy? Cardio. You can do treadmill, elliptical, you can run out. Well, it's hot outside. Don't do that now until the fall or the winter. Swimming is fine. Swimming is actually great. Like it's makes your belly weightless and your joints feel so much better. You can do an indoor bike, Peloton, whatever other bikes you all like. Weightlifting, you can lift up to your pre-pregnancy level. You don't need to add resistance during pregnancy because your baby and your body will increase that resistance. Squats are my favorite. You want to build up to a minimum of 50 squats a day. If you're already doing more than that, salute, go ahead. Just keep squatting. If you're not an experienced squatter, at 20 weeks, I want you to start with 5 a day. 21 weeks, give me 10 a day. 22 weeks, give me 15. And building up to at least 50 every day. And they don't all have to be at the same time. You can do them throughout the day. Pilates and yoga are also some of our favorite exercises, and any experienced instructor will be able to tell you what the pregnancy modifications are. So those, just anything that gets that pelvis open and those muscles long and lean, that's what we're looking for pregnancy exercises. High intensity interval workouts after your first trimester. It's not the intensity, it's not the interval, it's the intensity. You can do the low impact version of these exercises. They'll still get your heart rate up. We don't want you doing anything that has you lying flat on your back for extended periods of time, like excessive ab work. You can do side lying abs, you can do standing abs. Unless you are a hot yoga instructor and are fully acclimated to that environment, then hot yoga may not be, this isn't a great time to try that because you're going to get dizzy and pass out in there and possibly fall on your belly. Scuba is not a great idea right now because of decreased oxygenation to the baby. Same thing with high altitude hiking. You can do high altitude visiting. So if you want to go see your family in Colorado, going 8 to 10,000 feet above sea level is absolutely fine. Just you don't want to go hiking with them when you go visit. No contact sports, please do not take up kickboxing during this pregnancy. We've also had some pickleball incidents. So anything with a ball flying at you, maybe you want to hold off on. Outdoor biking is not a no, it's more of a watch out because around 16 weeks is when your center of gravity changes. And as you start trying to turn those corners, you may find yourself kind of tipping over and falling off the bike. All right, so it is time for a poll question. Okay, so now that we have talked about exercise and nutrition, can you prevent gestational diabetes by just eating well and exercising? And the polls will be closing in 5, 4, 3, 2, 1. It's always funny to me how many veteran moms are on here and have seen me ask this question before. This is, I think, probably the first group where more people are answering no than yes. Finally, my message is getting out. That is correct. You cannot prevent it. You can manage gestational diabetes with diet and exercise, but you cannot prevent it. The reason why is because everybody who is pregnant has a placenta, and the placenta gives off hormones. And some of those hormones tell your insulin not to do its job. make your insulin less effective. And the job of insulin is to clear the bloodstream of extra glucose. And if your insulin's not doing that, then you have extra glucose out there in your bloodstream. And that's diabetes, extra glucose in your bloodstream. Literally, that's the definition. But it's because of your placenta. It's because of your naughty placenta telling your insulin not to do its job. So if you can figure out how to do this pregnancy without a placenta, then I do not need to screen you for gestational diabetes. But if you have a placenta, then yes, you are at risk for gestational diabetes. And if you have twins, you have two placentas, so it's twice as much risk. So my moms would say, but I never eat any sugar at all. You eat good carbs, and we want you to eat them in the days leading up to the test so that you don't shock your body with this, with the glucose challenge. So your fruits, your whole grains, things like that, those are fine. The actual drink, if that is what bothers you, the preservatives and things like that, we do have options, which we saw on the website. There are a couple of options, and those are hyperlinks. You can link directly to the websites to order those things. We also have here in the office the Simply Pure drink, which is soy-free, dye-free, gluten-free, BVO-free, kosher, vegan, like offensive to almost no one. And then, as I mentioned, the additional patient-driven options. If you're going to be using one of these options, let your midwife know, because we can't send you to Quest. Quest does not accept outside drinks. You have to go to LabCorp. And we have to write on there that you're bringing your own outside drink. And then please follow the instructions that are on the website for that. Don't open it before you get there. Don't drink it before you get there. All of those sorts of things. But we'll remind you of all that at that point. Just let us know that you want to do an alternative drink. All right, preparing for birth. So these are our method classes that I have listed here. So childbirth education classes, the hospital does have its own routine childbirth education class. But if you're looking for breathing methods, ways to delay pain medication, these represent hypnobirthing, hypnobabies, Bradley method. I think maybe even Lamaze is on here too. I'm not sure. But again, these are just for informational purposes. These are a good place to start. Breastfeeding classes, the hospital does also have breastfeeding classes. Sonia's the lactation consultant there, and she is amazing. Every new parent should know CPR, and this is a link to the Red Cross to take CPR classes, just to have a nice refresher of infant CPR. And then if you're already seeing a chiropractor, good for you. If not, just be sure that if you do decide to see one, that he, she, or they are Webster certified, and that they because the Webster certification is specifically for pregnancy, just so that the adjustments that are made are not harmful to you and the normal changes that your body is going through. How many people on here plan to work with a doula? If you plan to work with a doula, go ahead and answer here. All right, polls are going to close in 3, 2, 1. Great. Okay, this is cool. So quite a few people are already planning to work with a doula, and some are not sure. So we're going to talk right now about why we like doulas and what doulas are, honestly. So doulas are there for emotional support and physical support before, during, and after pregnancy. So some will come with you to your prenatal visits, talk to you about what you heard during your visit too, just kind of help you process your feelings about pregnancy and what's going on with your pregnancy. In labor, they help with breathing techniques, changing positions, relaxation strategies, and things like that. They're not giving you medical advice or providing medical care. They're helping you to process your feelings about the medical advice that your medical team are recommending. They're not writing prescriptions, and they're not delivering your baby unless you're doing it in the car on the way to the hospital, which I don't recommend. For doula recommendations, there are a lot of wonderful doulas in the area. So talk to your midwife, because they are the ones who are in the rooms with the doulas. They know who's been supporting our patients well throughout their labors. Acupuncture and pregnancy massage are also recommended. They are very helpful with nausea if anyone's having a lot of issues with nausea, and then later on with sciatic pain, back pain. And then there are also treatments that for when you're ready for baby to come out, there are baby come out acupuncture and massages. Some massage places will ask for a letter from us saying that it's okay. And usually they won't even do it until second trimester. But we do have a standard massage letter if you need us to do that. Naisha can send that out to you. Most of your insurances will cover breast pumps now. Yay! We have an intermediary that helps to get the breast pumps for you. So please don't go and find your own company, look for your own prescriptions to do it. It's almost always a more arduous process. This company is very, very easy. The QR codes are in each exam room. So around the time of your anatomy ultrasound is a good time to do it. Scan the code. They'll send you what pumps are covered. Pick your pump. They'll write the script and send it to us. All we have to do is sign it and send it back. Easy peasy. People usually get their pumps within a couple of weeks with them. Finding your own company is a lot longer. They ask for all sorts of medical records, and it's an arduous process. So please just use the company that we found. You can take the little QR codes. If you or anyone in your family is planning to use FMLA, Family Medical Leave Act, for time off after baby, we are using Leave Guru, which is a third-party vendor. And if anyone has ever tried to get these forms filled out before, frequently it's a 10 to 14 business day process. Leave Guru gets these forms done in less than 24 hours once you fill out the things on your end. And Sierra is your contact to help you get their app downloaded and finish that up. After you deliver, postpartum care. So moms who have issues with blood pressures, 1 in 8 will have issues with blood pressure during pregnancy. That's our new reality. And we bring you back to the office about a week after delivery, between 4 to 7 days after delivery, to just make sure that you're not developing postpartum preeclampsia, because the first 14 days after delivery is actually the most dangerous for blood pressure. For my moms who had belly births, the incision check is at the 2 week mark. Routine mental health screens. Again, 80% of women will have baby blues, so normal hormonal changes in the first 14 days after baby. If it's persisting more than 14 days out, we might be looking at postpartum depression, postpartum anxiety, postpartum rage, and we want to get ahead of that. Postpartum doulas exist. They're like night nurses. They're like angels, really. They help you physically, and they will come and stay up and with feedings and all of that stuff. So just know that postpartum doulas do exist, and we can give you information on who those people are in town. The Motherhood Space is an awesome resource for those who are at risk for postpartum depression and anxiety. It's a program that is funded by a grant between Baptist and the Winston YMCA downtown. We also offer pelvic floor therapy here, which is standard of care in many countries. But pregnancy changes things. Whether you have a belly birth or you deliver vaginally, pain with intercourse, leaking urine afterward, difficulty with the tear that's repairing. Pelvic floor therapy, everybody starts it here at about 8 weeks after baby is born, and it's 8 weeks of sessions. I do finally have a question here. Any recommendations for massage companies that take the letter from the doctor? When you come out of the bathrooms in the front, you'll see that there are different places that offer services for pregnant clients. And you can use any one of those, and really any place that you go, like somebody gives you a gift certificate for a massage. If they say that they need a letter, just let us know, and we're happy to give that to you. Frequently asked questions. You can sleep on your left side, your right side, or your back. You can. You can. There's a certain number of people who get dizzy from sleeping on their back. If that's you, then get one of those little wedge pillows that goes under your hip from Amazon, and then you won't be sleeping on your back. You can help paint the nursery as long as you're in a well-ventilated space or wearing a mask. You can take probiotics and prebiotics. You can dye your hair, including your eyebrows. You can use gel nails. If you're going into the salon, though, and it's a lot of fumes, you may want to wear a mask just to keep from getting dizzy. Car travel is the summer vacation crew here. Car travel is fine up to 37 weeks. It's not dangerous after 37 weeks. It's just your baby doesn't have a calendar. And if you go into labor and you're not here, you might have a baby with somebody that's not full circle, and nobody wants to do that. Just be sure you're getting out and stretching every 2 hours. For skincare, you can use your benzoyl peroxide, your salicylic acid, just nothing that has retinol in it. So there's a substitute for the vitamin A derivative, bakuchiol, Bakuchiol. That's a substitute for retinol without the harmful properties to baby. And then air travel, flight is fine for singleton pregnancies up to 36 weeks, and for twin pregnancies up to 32 weeks. Just please, please, please wear your medium compression hose. Drink lots of water when you're on that plane. Like, you should be getting up to go to the bathroom. Like, you need an aisle seat, okay? And do your toe raises to exercise your cows, keep your blood circulating. Question I have up here is collagen supplements, question mark. Collagen supplements are just fine. Just be careful of your overall protein intake. Again, 70 grams is your sweet spot. Please do not collagen yourself into having an 11-pound baby. Summer crew, y'all stay away from roller coasters and water slides. Sorry about that. Jet skis too. All right, last thing is our upper respiratory updates, which are current still as of today. For vaccinations, specifically for COVID, ACOG moved from supporting either way to strongly recommending based on studying 35,000 pregnant women in 2021. Moderna and Pfizer are fine. We don't recommend Johnson and Johnson because of its independent risk of blood clots. All the vaccines are approved for booster injections. So if you're more than 6 months past your Moderna and Pfizer and you want to create antibodies to pass to your body, to your baby during breastfeeding, then the early third trimester is a good time to do it. If you've been more than 2 months past a Johnson and Johnson, you can get a Moderna or Pfizer because mixing and matching is okay. You'll be delivering around RSV season, flu season. You don't have to time them against you can get them spaced out or same day. It's all the same. And then the tetanus and diphtheria is recommended year round in early third trimester. If you do get COVID or flu or RSV or any of those things, please don't come in here. Thanks. There are also no formal recommendations for ivermectin, azithromycin, or Plaquenil. The recommendations here are that you don't come in here. Thanks. Convert your visits to virtual appointments. We do recommend vitamin D3, zinc, and vitamin C in the doses you see here. If it's COVID specifically, we recommend low dose aspirin, 81 milligrams, because there is an increased risk of gestational hypertension with COVID exposure during pregnancy. If you get COVID after 36 weeks, don't start the low dose aspirin because you'll increase your risk for bleeding more than you'll increase your risk for gestational hypertension. And then we do watch serial growth ultrasounds because the same thing that causes the hypertension also can restrict baby's growth. Supportive treatment at home. Remember, the website does have, our website does have information on what you can take for sore throat, congestion, all that stuff. You only need to go to the hospital if you're having difficulty breathing or a fever over 101 that you can't break down. Those of you who had your last baby during the height of COVID and are freaking out a little bit, take a deep breath. Everything is different now. We're back to our regular visitation situation. You can have 4 visitors in the room plus your certified doula. We're not routinely masking in the hospital or the labor rooms unless you are actually COVID positive or RSV positive or flu positive at the time of delivery. And even if so, we're not separating you from your baby unless you request it. We give you an N95 mask and an isolate to protect baby from your respiratory droplets. All right, so that is the end. We have this last poll question because you guys have been amazing. The last question is, what can you find on our Full Circle website? Can you find your birth preferences, safe medications, what to expect at each visit, or are you guys rockstar test takers and you're picking the right answer at the bottom? Fantastic. All right, polls are closed and you're absolutely right. This is the correct answer. All right, so please feel free to follow us on all the things. We are social. We are on all these things and we post sometimes, but just know that we had a series called In Her Words where people told their rock star birth stories, and that may be coming back soon because you guys really are amazing. So hold on, there is another question out here. Any apps you recommend to track the baby's growth? What to expect when you're expecting has a really cute comparison to fruit and different things to kind of make it real. The next one is my wife says she has to have a massage every night to help the baby grow. Is that right? Yes. And also you have to do the dishes and the laundry in order to help the baby grow. So just be sure that you are doing those things. Or, we just can't guarantee that we're going to have appropriate growth from the baby. So massage every night and dishes and laundry. All right. Any other questions? Any other questions on the floor? All right. Awesome. Thank you guys so much for spending this time with me. I appreciate you. And we will see you back in the office really soon. All right. Y'all have a great evening. Bye, all.